make a proper start. Hi, so welcome everybody to this first Spotlight seminar of this academic year. I'm Sarah Grosso and I'm the lead professor for the MA in Communications Management at Webster University, Geneva. And as part of my role, I also have the pleasure of organizing these regular events on various contemporary issues to do with media and communication. And we've been thinking about this topic for a few months now, that this event has been in the making, thinking about the huge risks associated with communicating risk. And although several months have passed since we first had the idea of the event, it can hardly be more relevant. And I think we see constantly how the COVID-19 pandemic has been bringing home the crucial importance of risk communication. Now, I don't want to say too much. I want to introduce my two guests who I'm delighted could join us today. One of my guests, Dr. Glenn O'Neill, is actually a Webster colleague. He's a lecturer as part of the MA in Communications Management in the Media Communications Department with me. Glenn is also the founder of OWL RE Research Consultancy, and recently he co-authored a report, actually with me, on risk, health and the environment for WHO Europe. So he'll be exploring some of that research with us today. Glenn is also the co-founder of the Geneva Communicators Network, who very kindly collaborated with us to organize this event. So many thanks to Glenn and to Patricia for your collaboration. My second speaker is Frédéric Descendier, who is the Director of Communications at the Hôpital Universitaire de Genève. Frédéric started her career as a journalist and a presenter. And before coming to UG, she worked at the Game Foundation, where she was the head of the communications department, and also at Gavi, the Vaccine Alliance, where she was head of media engagement. So thank you very much also, Frédéric, for finding time. We can only imagine how busy you are in the current context to talk to us.
Thank you, Sarah.
Thank you for coming. So I wanted to get the ball rolling straight away with a teaser question to entice our presenters. And that is, what are the risks of communicating risk? Maybe Glenn, you'd like to start on that question? Glenn, you're on mute. It's been over a year and still the wonders of Zoom technology. We might be experiencing a few technical difficulties again, such as the wonders of Zoom. Glenn, can you hear me? Sorry, Glenn's having a couple of technical difficulties. So Frédéric, would you mind starting on that question? So what are the risks of communicating risk? And hopefully we'll be able to hear you perfectly. Thanks.
So thank you, Sarah, and I hope that Glenn will connect quickly because I feel a bit lonely at the moment. But I mean, for us at the hospital, it's true that, and especially in the light of the pandemic, communicating about risk can be scary, especially for a population, internally for the employees. It's true that the HUG is the largest hospital in Switzerland, meaning that it's 14,000 employees, 2,000 beds currently in the hospital. And if we communicate too strongly about the risk that we are facing, You can have the population losing faith in the hospital. You can have patients being scary to come to the hospital, and you will have the employees and all the people working for the HUG being scared of working for the hospital. So it's true that it's important, especially during the pandemic and during a major crisis, to communicate accurately, to communicate in a transparent way, so that people don't lose faith and don't get scared about what's happening, because and we've seen that with the pandemic. You had so much information that was going around, what was true, what was not true, what was happening. It was really when all started in December 2019. Now, no one knew about the virus. No one knew what was happening. You had people getting sick, people dying, and it was important to be, especially as a hospital, to be a voice that was reckoned with, to reassure the population, to reassure the employees, etc. So I think here, again, it's important to maintain trust, to maintain confidence with the hospital, etc.
Thanks very much, Frederic. Glenn, did you rejoin us?
So I'm here. I just can't stop my video because it says it's been disabled, but I will go on. Just to say that, no, I think from what I heard from Frederic, I fully agree. And to say that I think really that, risk communication is all about communicating information when, people are facing a risk or a threat, as we saw with COVID. So it's really giving information so people, can take informed decisions. So it's even broader than health. It can also be about, financial investments. So I think really the biggest risk is really that, that the communicators, so from the side of the people communicating, that we don't understand really, the full risk. So there's some uncertainty in what we have to communicate, and also understanding how people, how they basically understand the risk. And that's often one of the main challenges is the difference of how the public understand the risk and how the experts understand the risk, I would say.
Okay, thanks. So one of the things that you mentioned is the importance of transparency and trust. How important would you say that trust is in risk communication? And Glenn, apologies for the issues with the camera. We're working on the technical side of the scenes here.
I would say, of course, yes, trust is so important, and also what Frederic said about people turning to the hospital. What is, of course, trust has been basically declining in institutions globally since decades, actually. The positive thing in COVID is that actually the trust in science has, in some countries and amongst most audiences, not all, has increased during COVID. So that's where we need trust, of course, in the scientific and the medical experts. But we have to put that in the context that today, for example, in the US, virtually half of the population actually rely on social media for news, but it's the least trusted source by the same people who are relying on news. So people say it's the least trusted source. Actually, interestingly, the most trusted source is searching, doing your own searches on the internet. So, that idea that you have some capacity to judge. So I think that, establishing and gaining trust it's a complex task, is what all the studies show. Certainly by showing empathy with the public to their concerns, listening, feedback, and dialogue is what is needed.
Empathy, feedback, and dialogue.
If I may add to what Glenn is saying, there was a study that was done by Reuters, I think it was 2 months ago, about the trust perception from various audiences, and it was in various countries, and you had a similar red thread which was saying that basically during the pandemic, people were not trusting the media anymore, not trusting also the social media. However, they were trusting, and this is interesting, they were trusting much more the institutions, not the governments, but the institutions, yes. And especially the institutions and their CEO and the institution that they were working for. Because I think, and it might be something that has been happening more generally within businesses and within companies, etc. Perhaps the leadership understood that they had to communicate internally a bit more proactively, and they had to provide information, insight about what was happening around. And in fact, people turned to their CEOs or their leadership to have trustful information. And it's something that really is really was for me surprising, that people were trusting more their institution and their companies for reliable information.
That's really interesting. That people are turning to the institutions as a trusted source of information when others maybe are lacking. What would be some good practices when communicating risk that we can share with the audience? Glenn, did you want to start on that one?
Yeah, no, and add to what Frederick said about also that whole question of trust in institutions is, in fact, Frederick, is also the studies show that, you know, trust in politicians has gone down and has decreased during COVID. So it's really a concern there. So yes, trust in institutions, particularly medical and health start. I think certainly in good practices, you know, is we always have to think, like all good communications, think about, you know, who is communicating the message. Is very important. Like we see, for example, in the Hoog, the hospital where Frederick is working, you know, they have short videos where it's doctors, men and women, young and old, basically giving some key messages, and that's very important. You know, you can see they're in a medical setting, you can see they're medical doctors or nurses, so that's very important as to who communicates. Is one thing. Secondly, also, you know, really understanding who has influence and on the public and optimizing that. That's what comes out time and time again. It's also basic good communication practices. And also, you know, understanding that in risk communications, it's often not only the facts that will do the talking. It's that the facts are unfortunately not enough, which is sometimes challenging to persuade the scientific and, you know, medical legal colleagues that, you know, we need to counter all the emotions by also showing some compassion and empathy with the audiences. So that's just to say that when we communicate, you know, we cannot, unfortunately, just rely on the facts. We have to factor in other elements. As I said before, who are we communicating? How are we communicating? You know, for example, we see patients that communicate. We see people that have been affected, impacted by, you know, a crisis situation communicate, for example. So that's just some points, but I'll hand over to Frederick.
Oh yeah, I mean, you're totally right, Glenn. It's true that what we did at the HUG, it was really to have a lot of Q&A, video Q&As, so that people can exchange and share those short videos about science and about what was the knowledge at the time we were issuing those videos. Because, as you know, during the pandemic, the knowledge about the disease, the knowledge about the treatments, and even vaccination, it has evolved on a daily basis. And also from an internal perspective, we were much more proactive in communicating what was happening at the start of the pandemic. It was in January 2020. We immediately started to have a crisis meeting with all the heads of the department, who were proactively also communicating with their teams, and we did short videos from our CEOs to communicate to the staff, meaning to 14,000 people. Communicating about what was happening, what was the reality, what was happening from a management perspective. And it's true that it helped, because the people within the organization were looking at the CEO, and they were aware, and the information was shared on a daily basis in a really proactive way. And I think it was important. To your point about science, and especially considering the current fake news issues that we're facing, the good thing is that we have a lot of science people and scientific people within the HUG. Again, I mean, close to 10,000 people are doctors or medical or nurses or medical staff. So we really use that network and that knowledge and all the research that's been happening with the University of Geneva to proactively put outside of the hospital and on our networks all that information, and sharing information with the population and internally.
Thank you. So you're also fortunately able to be a trusted source amidst all this misinformation as well in the pandemic. How else have these practices helped with communication during COVID? Are there any particular examples you can share of risk communication around COVID, or how this has changed as well during the pandemic?
So in terms of workload, from a team perspective, for my team, I mean, we had a really busy year, 18 months exactly. It's true that we multiplied, and we had so many questions from media, questions from the political sphere, from internally, that we had to step up and to really raise the number of content that we were putting out to internally, both internally and externally. I think what it changed is that, and one thing that was important for us was, again, to be trusted and to be science-based and fact-based. But one thing that was really important was transparency, and sometimes to say that we don't know everything, and even as a fact-based organization and as a science-based institution, sometimes we need to say, here, we don't know. I mean, the virus is evolving. We have that. It might be that. It might be that. But we don't know. I mean, from the level of knowledge that we have, and sometimes being honest, I think is really important, and just tells people. I mean, I think people understand that sometimes you can say that you don't know. I mean, but it's really specific to the pandemic, I think.
Ah, interesting. Glenn, is there anything else you'd like to add about how risk communication has been changing during the pandemic?
Yeah, no, I think as Frederick said, certainly the recognition, and it's something that has been studied before in risk communication, is, the uncertainty in science, and that's something that's come to the forefront in COVID and communication across the world. For example, communicating about masks, communicating about getting COVID from services, etc. And the science has basically changed over the past 2 years. Now we know that masks are effective, for example. So this is always going to be a challenge. And from the communicator's point of view, as Frederick said, yeah, to be honest and to say sometimes we don't know. And studies show in the past it's quite challenging also for scientists to say that, because also they often want to communicate only when the science is certain. But communication has shown, and the fast pace of COVID means that we have to be able to communicate even when the science is not certain. And it's also, studies show that the public is sophisticated enough to understand that. I think also what has been shown is in COVID is that how people perceive the risks of COVID is really related to social, cultural factors. and also their own ideology. In COVID is one case where there's been studies that show, in the US, there's a clear link between your belief in conspiracy theories and your non-acceptance of the vaccine as a possible, solution. As an example, so it's an interesting case. I think that will be looked back on at years. At the same time, these social and cultural factors are also complemented by experiences, but experiential factors, as they're called. So people's actual interaction with COVID, knowing people who have COVID, having COVID, really changes a lot your attitudes and your behavior. And this has been shown in many countries, and when you think about it, of course, it makes sense. So I think this is a couple of points that I would point out on this one.
Definitely, Glenn.
So maybe thinking about risk communication more broadly, do you have a sense at all of how COVID has changed how we communicate risk?
I mean, definitely, I think that there's going to be in communication and and probably in everyday life also, there will be a before and after the crisis. Honestly, I think that I mean, as I was saying before, doctors have understood that sometimes they need to be humbled. To be humble, and humility is an important part of crisis risk communication. I think also the way we communicate about trust and transparency, I think it's something that really, I think, I mean, change in it's not about marketing anymore. It's really about, even if you might have some marketing and you want to you're not selling a product, I think, and that's where I think communication has slightly changed. One thing that I find interesting also is the agility, and perhaps, and that's what give me optimism about the agility of all the level of society, and including communication. We had to probably to change the way we communicate, perhaps. I mean, and more on the core content than on the superficial layers. And I think this is also something that has evolved. And yeah, definitely there will be a before and after the pandemic, I think. I don't know, Glenn, if you agree with that.
Yeah, no, I do, and I think that of course we don't know the long-term implications yet for what it will mean for society and healthcare, and of course the communications. Certainly there is I think a lot to learn in terms of from the communication and communicating risk that will be of interest. I think that notion, as we spoke about, about how to communicate and how to understand the need to communicate uncertainty. How can we understand the publics we're communicating, particularly in this case, we're really, from the communicator's perspective, it's really you're trying to reach virtually everyone in society. So it's different from when we learn in communications to be specific and targeted. Here we are targeting people, but of course we can also look at what's happening now in Switzerland and all countries where you're reaching over half the population vaccinated. So in countries like Denmark, I read it's 85%. So how to reach those audiences, for example, when you're looking at vaccines that are not convinced or not persuaded. And here I think one lesson is that we've learned is that basically how can we work with the communicators work and basically communicate with people who are really persuaded, for example, not to be vaccinated. And that's going to be a challenge. It also comes back to that. I think that point that where we can say, well, you know, in some cases, communications will not solve all problems. Some of these problems are deeper in terms of ideological and political beliefs. That as the amount of communication you do will not necessarily change it. Maybe who is communicating and how those people, audiences interact and how they receive information, that could possibly change something. But we have to see also, I think, the limits of communications in some cases. That's just a few thoughts, but I'll hand back to yourself, Sarah and Frederick.
Yeah, no, definitely, Glenn. Perhaps to add to that, perhaps the safe, to be on the safe side when you're communicating risk, it's also about not giving a value judgment or an opinion. And I think that people appreciate that you're not giving your opinion as, for instance, a government or opinion leader, but you're more on the science. And I mean, it's easy for us at the HUG to talk about science because, I mean, we are grounded on science, but it's also about making the difference between value judgment and science, fact-based information. I think here it's been critical during the pandemic.
Yes, agree completely, yes.
Thank you both. I apologize for some noise happening in my current environment. We've had lots of interesting points from our speakers. I like to make these events interactive. So I'd like to invite anyone in the audience who might have some questions for the speakers. I can see there's a couple in the chat, but if Boris would maybe like to ask this question yourself, or otherwise I'd be happy to read it out on your behalf.
I mean, if you can read them, that would be helpful.
Yeah, sure.
Because I can't see them on the screen.
No,
Sorry
that's
about
fine. So if that's okay with Boris, I can go ahead and relocate the question and read that for you. So Boris is saying to us, is that a question or a comment? I'm not sure, we'll see. In the case of COVID, official communication has been hectic, not for lack of good intentions nor professional expertise, but because, in this questioner's view, between two conflicting values, ethically, how could I talk about my is the audience able to put on their microphones? To my colleague. In any case, I'll read his point in the meantime so we can hear. So between two conflicting values, ethically warn the public that things are out of control and scientifically pretending that researchers and doctors know enough. So possibly that's more like a comment. But the same questioner is asking us that this morning, the boss of Amnesty admitted that we live in a repeat of the 1930s, but do we as individuals or as collectivity get ready?
Can you hear me?
Yes, we can, Boris. Wonderful.
Yes.
I speak with my voice. That's great.
Although I am an emoji, I am emoji with sound. So indeed, all I have to say, I put in writing. I think it's no need to push my point of view through too vocally, but I have two different kinds of worries. One is you worry about COVID, and I just wrote that comment or question which you just read, and a broader one is that in a democratic society, it is near impossible to be pessimistic. There are a lot of quotations about pessimism and the role of pessimism. There is a quoted quotation by Antonio Gramsci. There is a very macabre joke after World War II that the pessimists live in New York and the optimists died in Auschwitz. So it's very difficult in a democratic society to address worst case scenarios. And when the future is rosy, it's not a problem. But when the future is bleak, as I believe it is, and as the boss of Amnesty confessed reluctantly, then it's really a problem. How do we address worst case scenarios when we know that it is unpopular. It is totally contrary to the optimist of our learned society and science-based society, etc. This is a basic issue in my eye, but how can we discuss that? It's something which has no solution. So that's why I prefer to make ironical comments in the chat box, and I don't know how to turn it into a useful debate.
Okay, thanks for your comment, Boris. Would either of the speakers like to respond to Boris's comment?
So perhaps I'll jump in because, I mean, personally, I'm an optimistic. I strongly believe in knowledge, in people, in human intelligence, and in innovation. And I think that when we are faced with challenges, I think that it's always the best within everyone that comes out. So that's my vision of the society. And again, I'm an optimistic. I think here what we can address perhaps or point one thing that it's a question that I've been wondering. We talk a lot about crisis communication and having a plan and being ready, having processes, etc. I think we can work on processes to be ready and to be and have efficient process, so that when there's a crisis coming up, you will have the relevant people being in charge, and you will have the good meetings, and you will have all the reactive points ready, etc. And it's helpful because it helps you having a kind of a roadmap in case there's a crisis. However, I mean, when there's a crisis, it's also about people, and you don't know how people react when there's really strong crisis. Some people who you thought were leaders become followers. And on the contrary, people who are more followers become leaders. So there will always be that, perhaps that unknown factor where you don't know how people will handle that. And I mean, for me, you can put all the best processes in place. At one point, it's the people who are handling that. And this is where being alone doesn't work. You need to have that collective intelligence. You need to have that partnership. You can't work alone when you're facing a crisis such as the pandemic. And again, I strongly believe that it was that human intelligence that we put together, that all that goodwill that appeared during the pandemic that happened, that is, for me, the most positive side of the pandemic.
Thanks, Frederic, for that optimistic answer. Glenn, did you want to add anything?
No, I see someone else has their hand up.
Yeah, I can see someone patiently waiting. In that case, Ayan, would you like to ask your question?
Yes, hello, Shafak speaking. I have a question for the panel. I don't know if you have, I missed the first few minutes. I wanted to know, how do you measure success in risk communication? How do you actually see when you've been successful or not?
Great question. Right up the street of our panelists as well.
Yeah, I mean, I think it's very challenging to measure the success. I mean, we can measure traditional communication measures, like, you know, how many people have we reached, how much have we seen in terms of the change their attitudes and behavior. But to do that means we already need to have you know, sort of a system and approach in place. So it is challenging. In some cases, I think they would say, well, in communicating risk, also it's about avoiding you know, avoiding the possible crisis that could be coming up. So there are possibilities. Maybe Frederic can add also.
I mean, from the hospital perspective, I think it's you don't have really KPIs to measure the success. However, you can look at the health, the mental health of the people working within the hospital. When you see a rate of burnouts of people going out on sick leave that is raising, it can be a measure of your communication and how they have received that communication and how they feel within the environment, bearing in mind that it's not only about communication, it's also the work environment, etc. You can see and measure your success with the news coverage, how many times you were quoted and positively quoted in media or negatively quoted. I think it's a 360 kind of KPI. You need to take a bit, and it might be more of a perception and less of something that is really perhaps science-based. As Glenn was saying, you can measure you can measure your perception, you can measure the numbers of tweets that you've been doing and how they've been how many reactions there were afterwards. I mean, there's something that is really hard to measure, which is the how did people receive that and how positive it was. And to be fair, I mean, I'm still struggling as the head of the comms department on how you measure all that and how you measure your success. I mean, it's a complicated issue, and it's a great question, and I think that all communicators probably ask themselves the same question.
Can I ask a question, follow-up questions related to that, if I may?
Yes, sure. And then we have one other question coming, but please go ahead.
Thank you very much for your response. Yeah, that's sort of what I was expecting, I think. But I wanted to know, because this is a public health issue, and you would require, from that perspective, a certain reaction or action by the public. So there must have been some form of institutional, I would say, institutional measures given by the institution in order for them to say, we have achieved what we thought we should have, in some form. There should have been a very high level sort of expectations. Is that something that we have seen in Switzerland and that trickled down to SUG, for example? I don't know if I've made myself clear. Is that?
I mean, yeah, I understand your question, but I mean, you mean from a federal perspective or from an institution perspective?
From the federal all the way down to the institution, then to the public. You understand my point?
Yes.
There must have been one. Yeah, I'm thinking about that perspective.
So I mean, expectation might be a bit strong of a word. Again, to the point when I was talking about partnership and working in a network and with all the health network within Switzerland, I'm talking only about Switzerland, but there was strong collaboration. But I mean, I can't say that there were some expectation or deliverables to give. I think here, considering that it's a public health issue, it was basically about, I mean, saving patients' life, trying to have patients that are not coming to the hospital, trying to not have situation as we've seen, for instance, in Italy, where you had to triage the patients and make a selection, and having wards that are overwhelmed with people. So here, that was the issue. I mean, we didn't have some kind of we didn't have, I mean, deliverable from a KPI perspective, but on a daily basis, we were seeing, and it's not about, I mean, it's less about communicating. I think it's more about doing things. I mean, we were seeing every day what our work was doing from a tangible perspective on the ground. I'm not sure if it answers your question, but here, I mean, the result of our action was immediately tangible.
Thanks, Frederic.
Yes, thank you.
Glenn, if you don't have anything to add to that one, we can take a last question from
Go ahead,
Anne,
yeah.
who's been patiently waiting. And
Thanks, Sarah.
Thanks.
And thanks for the very interesting discussion so far. You have spoken, and quite rightly in my opinion, about risk in the context of an ongoing crisis, specifically the COVID-19 crisis. However, I was wondering if perhaps either of you had anything to say about how we can communicate risk for what one might term low likelihood, high consequence events, which rightly or wrongly, you know, the emergence of a pandemic such as the one we're currently living through was deemed to be prior to its emergence. Now, looking at, you know, some of the people attending here, I think many of us, you know, work for, you know, research labs, UN agencies, so on and so forth. So we are trying to communicate risks that are, you know, perhaps low likelihood or perhaps not as low likelihood as we would like to think, but could have very high consequences for all of human society. So I wondered if Frederick or Glenn, you had any thoughts on that and how, if at all, the COVID-19 crisis might have impacted upon you know, the salience of such issues for the future, whether it is now perhaps going to be easier or harder still for us to communicate on these low likelihood, high consequence events.
I can maybe jump in to say, no, it's a very good point that one of the concerns also expressed by people working on everything from air pollution to the danger of you know, nuclear accidents is that, of course, COVID has taken all of the attention and all of the energy in that respect. At the same time, what we also see is that yes, maybe people are going to be more aware of these sort of ongoing potential risks that exist with the environment, with health, and so maybe that has been perhaps a positive outcome of COVID, as COVID really came, you know, we could say from a formerly low risk you know, event. But I'll hand over to Frederick, because I know she has to go soon, so I'll let her give some inputs.
Sorry, I can hear. Yeah, great. Thanks, Glenn. So, I mean, here it's true that, as you were saying, that that COVID has taken all the spotlight and the limelight, and it's going to be really hard for other topics to kind of find some space. At the same time, people at the moment, it's the fourth wave. Considering that the virus is here to stay, and we're seeing a kind of a model that is close to the flu. I mean, at one point we won't talk about COVID anymore because it will be kind of in our everyday life. And as you know, information and communication goes in cycles. So I strongly believe that probably next year we'll start to talk about other things than COVID, and also because people are really fed up with the pandemic and people want to get out of it, and I can see that at the hospital. I mean, people are tired. People want to go back to their normal job, to do I mean, to do things that they used to do. So I believe, but it might be just a belief and not rational, but I believe that I mean, next year probably, I mean, we will stop talking about that, and we will have other big global problems that we will need to deal with, bearing in mind that when we see the energy that was focused on, for instance, delivering a vaccine for COVID-19, it gives us hope that we can apply the same energy to other big causes like climate change, like I mean, just food security, or other issues like this that are also really important for humanity.
Well, thank you ever so much, Frederick. am I right in thinking that you need to sneak away?
Yes, I'm sorry. I have another crisis meeting. So
COVID
thanks,
meeting.
thanks a lot, Sarah, for the invitation. It was
Thank
great to talk with you and to talk with Glenn. Thank you, Glenn. And thank you to all the people who participated don't hesitate to send me an email if you need more information or something. I'm happy to answer questions. So thanks again for the interaction.
Thank you so much, and
thank you.
Thanks for ending on such a warm and hopeful note as well, such an optimistic note. And we wish you
I'm an optimistic.
We shall remain in touch. Thank you. Have a wonderful day.
Thank you. Bye-bye.
Maybe, Sarah, there was one question from Juan Michel.
Yes, that's what I was thinking, actually. That would be actually it's a perfect question for you, Glenn. So
yes,
if you'd like to do that.
Yeah, his question was a very good point, and hello, Juan Michel. In terms of saying, what about surveying before and after a communication campaign, for example, on vaccination? Isn't that a good way of measuring? I think it's, yes, exactly. It's a very good point, and it is a good way of measuring. The challenge would be that, particularly when we're talking about vaccines and vaccination, is that there's so many different factors that can influence the decision of someone to be vaccinated. And that's the challenge for the communicators, is really trying to determine what was the communications role, which you face in many other areas apart from this. What one solution is in surveying, for example, is that you ask the people, what was the influences on you? Was this because of you read about this media campaign from friends? Or, for example, in Switzerland, as we've seen, the imposition of the COVID pass. You can do that, and that's often what is done is in communication campaigning. And the challenge is always to separate out the role of communications from the other factor. In the case of vaccines, what we've seen, for example, in France, when they introduced the equivalent of the COVID pass, in some regions that led to a 20% increase in people taking the vaccination. So there you can see, for example, in Switzerland, you'd probably see a similar effect. So when we look at communications, we don't want to take credit for everything. So in certain cases, it would be probably relatively clear what were some of those drivers to any increase in vaccination rates, for example. So that's what I think. It's I think certainly and I wanted to say that before, that I think certainly that's some of the global measures that the Swiss government is looking at, and that the expectation across the board from all the health actors is certainly reducing the number of infections, increasing the vaccination rates, I would say, are some of the very, very global KPIs that, of course, they are looking at. And also what's interesting is that these are published. We can also look at them every day if we're interested. Thanks, Sarah.
Great, thanks, Glenn. We're digging into some of these classic issues around attribution, right, related to communications campaigns.
Cause and effect.
Yeah, and also the ability of communications campaigns to affect behavioural change. There's other complex issues that we're all probably interested in. I wanted to ask at this point if anyone else in the audience has a question for our remaining panelists. Everyone's potentially very shy or forcibly on mute, one of the two situations.
Look, if no one else has a question, would you mind terribly if I asked another one, Sarah?
Not at all, please go ahead.
Sorry, I don't mean to take over with too many questions, but Glenn, I wondered if you had any thoughts on what's happened in a lot of cases. It seems to me is that where there is evidence, and where there are people with backgrounds in science communication, risk communication, so on and so forth, they've often been sidelined in favor of tried and tested political communicators. I'm thinking with an eye to my home country of the UK, where a lot of the messaging in the early phases of the pandemic was run by those who were in the government's communications team at the time, and thus were those that were responsible for the Vote Leave campaign during the Brexit referendum. And to me, it felt that we were sort of discarding or wasting time while people relearned some of the basic messages of science and risk communication. What do you think about that, Glenn? I mean, I followed Germany and France because they're my other countries, and they also seem to suffer from this a little bit, but perhaps not quite as markedly as the UK did.
Yeah, no, it's a very good point. And also in the UK in particular, they made some studies on, the reputation of the political communicators, in particular I forget, is it Cummings, the one who broke the COVID rules?
Yeah, Dominic Cummings. Yeah.
Dominic Cummings, yes. And this also, when they did studies, showed it had a really, they said, a direct impact on the people's willingness to trust what was coming out of the government. So in many countries, we've seen that, where the politicians have tried to take center stage. But I would say in most countries, it has not been so successful. Maybe in Switzerland, with Alain Berset, I think he's the Minister of Health, it has been more successful. But in most countries, what has been seen, I think, is the politicians taking control of the messaging hasn't really worked so well. It's certainly the case in my own country, in Australia, where the politicians have tried to take control, but in fact, a lot of it's been basically also now mandated to, like, the national health officers or the state level senior health officers. So I think what we can say is that the politicians sometimes, how can we persuade them and their communication allies that perhaps they're not the best always to pass a message. And that's what the studies and research show, that people have much more trust in health and scientific figures. The challenge then is to make sure that scientists and the health experts do communicate in a way that is understandable and persuasive. We do see good examples of that. I know in Australia that several of the senior health officials who speak are very good. And also in the US, we've seen that. I mean, I think Dr. Fauci is someone who speaks, relatively clearly and straight, and you can see all the problems that got him into over there with the political message didn't match the message that was coming out of the science. So that's just a couple of thoughts on that.
Excellent. Many thanks, Glenn. I don't know if anyone has any final burning question they'd like to ask in the remaining minutes. Because if not, then it remains for me to say a warm thanks to both our speakers. I said thank you to Frederic, but thank you so much, Glenn, also for joining us and sharing your expertise, as always. I hope everybody's enjoyed this event, and thank you very much for joining us. If you're interested in future events, I'm sure you can join our mailing list, because we try to have regular events about media communication related topics. And I'm also actually very open to suggestions, because I like to have people being involved in helping shape these events, because they're essentially for you. I'm also trying to kind of do a service for our local community by doing events on topics that are of interest. So I'm Sarah Grosso. I can put my email in the chat in a moment. I'd be very happy if anyone would like to reach out if you have a future event, or indeed, I'm happy to be in touch for any reason with this lovely Communicators Network. So thanks to Glenn for your participation and for the collaboration, to Patricia also, and collaborating on this. And thanks to Celia as well, who's been helping me run this in the background so kindly. And thanks all to you for participating. Wishing you a lovely rest of the day. Thanks. Goodbye.
Thanks, Sarah. Bye.
Thanks.
Thanks very much.